The IMG Roadmap is the only podcast dedicated to coaching international medical graduates in success blueprints for this unique pathway. I am Dr. Nina Loom, your host, a previous IMG turned hospital medicine physician, healthcare administrator, speaker, and coach. I empower, encourage, and equip you with actionable steps that you can take towards the residency position of your dreams. Hey guys, welcome to another episode of the IMG Roadmap podcast. I'm super duper excited to introduce today's guest to you. For those of you who know, I'm from Cameroon, born and raised. I have like a deep sense of core values that evolve around being Cameroonian. And today's guest, identifies the same, but he has a very different story. I mean, we're looking at someone that's, completely different from me, Cameroonian-American, went to school in Poland, and now is like this awesome position out in the Florida area, just doing great things. And I want him to tell us about some of the work that he's done. But before that, let me introduce you to the one and only Dr. Dr Tabi. Welcome on the show, Dr. George. How are you?
Thank you so much. I appreciate the introduction.
Yeah, I'm so excited to have you on. So we were actually chatting right before I hit record. And we were already going into some of your background, but can you just tell us again, maybe, who you are, what you practice, where you're located, and really kind of like a little bit about yourself?
Yeah, so my name is Dr. George Tabi. I am a board-certified family medicine physician as well as sports medicine. I am originally born in New York City, raised in the Bronx. My mom and my dad are from Cameroon, West Africa, Bamenda particularly. We kind of grew up here early in the 80s in New York City. My sister and I, who's a bit younger than me, who's also a family physician as well in the New York area. And, we kind of got a taste of New York City early, the upbringing. There's a lot of, crazy things happening in the 80s in New York City. So it was rough for my mom, particularly with my dad and her having to be separated due to his work. Criteria that he had in Cameroon was a bit better situation. So he moved back to Cameroon and was basically my mom trying to hold it down in New York City alone for me and my sister. So her being, finding herself and getting these odd jobs and finally entering the nursing field where she had a bit more stability, but she often traveled. So she did travel to, Duke University. She worked in Duke University, the Research Triangle. She then later moved to Emory and started working in that area in Georgia. And from that time, we moved to Atlanta, Georgia to support the work that she was doing there more. And I ended up going to a boarding school playing basketball. And from that boarding school, I earned a basketball scholarship to Reinhardt College, where I played basketball there for a couple of years before transferring to another school for sports. And then I ended up in medical school in Poland after an injury, actually. I had an injury to a distal hairline fracture to my fibula. And that actually made me change my position with, what I wanted to do with my life. And that was a pivotal moment for me, actually. And that's when Poland became a real option because of a friend of my mom knew. So that's just kind of where my journey began in medical school.
Yeah, that's pretty interesting because I don't know a lot of, maybe I would put it this way, like Americans that have left to go to medical school in Eastern Europe. I see a lot more Americans going into the Caribbean islands or some going to India or Pakistan. So, then I also realized that I've heard a lot from students that are located in different parts of Europe right now that are looking to transition to the States maybe because they have family members and such. So can you give us a little bit of background to your story? Like, what was it like? What was your curriculum like? How did you incorporate your plan to come back to train in the U.S. into your medical school training?
Well, uniquely about me, I went there without doing much research on either, U.S. versus American school versus European school in the format. I was going mostly off the passion. And I think my point is for everybody out there is the most important thing about when you're deciding to go to medical school is forget the time, forget the amount of money you're going to make when you're done. Forget all of that, because no matter what route you go, it's going to be difficult. The medical school journey to Poland was a special one because I had no idea that there was something called a 6-year program or a 4-year. I didn't have any understanding of that. I just thought medical school is medical school. And at that time, they had just started opening what they call the 6-year program, meaning that you could have done some of your college or no college at all and come straight from high school into this medical program. So I kind of had a situation where I was a sophomore in college where I got injured and I entered the 6-year program because I still had undergraduate credits to complete, along with just coming out of high school, only a sophomore. So I ended up doing a 6-year program. So it was 4 years in Poland, 2 years in my clinicals in the United States. It's English, but it's broken English, right? So there are people that the professors out there speak English, but it's a second language. And they use a lot of United States training material. So step 1, first aid, Kaplan, PASS program. These are a lot of the recommended programs that we use throughout the years alongside of their curriculum that teaches us, all the basic medical courses that we have to have alongside of that to help us be prepared to come back to the United States. Because when you're in Europe, they're focusing on things that are related to their country, right? We took courses that had nothing to do with issues that we really had here as much, because they have different general population of people that come in and out of their country, where in the United States, we have certain diseases that we'll never see, in this country because of the way we, vaccinate and the way that the immigration works in our country, right? So it was very different as far as our studies, because we took classes that you would never take in American or Caribbean courses, because a lot of the Caribbean schools have curriculum directly made for you to come to be a U.S. school. A lot of the schools in the Caribbean are, United States made schools that are just in the Caribbean. Whereas in Europe, they have their European standard schools that are for Europe. If you come from another country and you end up having to go there, that's fine, but you have to pass the test the way they have to pass it. There's a lot of practicals that are oral. They don't very seldomly use multiple choice testing. A lot of things you have to speak orally to discuss in order to pass. So that was different from me being a United States, developed student, right? Taking college courses where you have to take multiple choice answers. It's a different technique of studying. It's a different technique of answering questions. But it was a good challenge, because I felt, for me personally, if you have to remember or answer a question to a professor and express yourself, I like that. Sometimes in multiple choice questions, I don't often get to express why I selected that answer. So it's just, that's what you picked, I'm the kind of person to express myself. So that was a bit of a benefit for me that I noticed with the European studying in that setting versus what I've experienced from what my friends and colleagues in the Caribbean schools and U.S. schools have discussed with me. Professors are a bit more passionate as well, because the doctors there that are teaching you are working physicians, usually in that country and area. And so they give you a lot of clinical experience, and versus sometimes in schools it's just professors. They're not really practicing physicians teaching you. In Poland, we're very much so practicing physicians teaching you. Like for my pathophysiology class, it was a cardiologist. It was a bit different in Europe, because a lot of the time we had practicing physicians that were teaching us a lot of this coursework. So like for my pathomorphology course, it was a practicing interventional cardiologist teaching us this for our pathomorph of the heart. Right. If it was a different organ or whatnot, it was usually a practicing physician who was working, not just a professor, university level teacher of some sort that hadn't really practiced. That's more PhD. These were more MD or MD PhD level people. So it was a big deal for them to be able to put this aside as their practice to come teach students. I think that we gained a lot of clinical knowledge and a lot of clinical correlation to our knowledge base, which helped me in the long run. I think looking at the way I see medicine is a bit different than a lot of my colleagues earlier on. I had a different confidence because they kind of treat you like junior doctors, not really medical students, if that makes sense, in Europe. Because of the kind of people that were teaching you. They weren't, like I said, just professors. And there's nothing wrong with that. It just was a different level of expectation, right? Because if I'm a clinician, I'm practicing, they're not just teaching what's in the book, they're teaching what you're going to see in real life, which is very important in your clinical training. A lot of the time, we all get trained well. It's not knock on anybody training us, but it's different settings. Your perspective is based on who taught you what. It's just like your upbringing, right? If you had a mother that was a physician or a lawyer or a certain level of professional, your upbringing, your expectation is much different than being the first generation, right? So similar to that is what I would feel like when you compare my experience and my my medical school upbringing versus maybe someone else that had a professor of just teaching in that university. So that was special. I think that was a very big aid in my growth as a physician.
Yeah. So let me ask you this question. How did you incorporate preparing for the USMLE? Because you mentioned that you had to complete your last 2 years of medical school in the States. So at what point did you do the boards? And tell us a little bit about sort of your board prep into your match story.
Yeah, so it was awesome actually. Like when I got back to the United States, I actually kind of just locked in. I went through the PASS program with Dr. Francis. He's awesome. Shout out to Dr. Francis out in Champaign, Illinois. He really held me down. Prior to my last year in Poland, I also did Kaplan down in the city in New York City, which was great. Great experience. These are things that kind of helped me zero in on what the United States wanted to see from me, right? So that was why I thought that was very important. As an IMG, I think even if you don't go to the courses live, you got to get information that is pertaining to the test that you're trying to take. At the end of the day, you're going to have a wide base of knowledge coming back from med school. You're going to have so much information. But the key to these study guides and these study programs is to try to zero in on what's important for the boards, how to answer the question. Your knowledge can be vast, but you've got to figure out how to answer the question. And once you understand how to answer the question and how these questions are worded and what they want from you, you do really well. And it takes time for it. Not everybody's able to conceptualize, which is very important. Memory is not going to get you through things. Concepts, understanding the concept of what we're trying to say, because concepts help you not have to memorize.
Yeah.
So for me, that's what was great when I did, these programs. It helped me understand concepts of what the United States looked at for you to answer these questions. And the process for the match, for me, was very similar to some people that may experience. I went through Wyckoff Hospital for my clinical rotations, Brooklyn Hospital in New York City, and then I actually did a pre-match situation. I graduated in December 2011, and I had matched mid-month of December. So I finished my last medical rotation for my schooling was like December 8th. And I think like the 20-something of December, that, 2011 year, I had pre-matched at my, not necessarily my first choice. I pre-matched at a place where I felt that I had the best connection. And I think that's also important. I had a lot of expectations with the places that I was interviewing. I probably had about 15 interviews. I went to about 3. The third one, I knew that the connection was real. And honestly, the next 3 were the ones I wanted the most. It was like Ohio State, it was Duke, it was like Kansas, and they all had great sports medicine programs because I'm an ex-college basketball player, right? So I even played basketball amateurly in Poland while I was in med school. So I was just like, sports medicine. I'm going to be a sports doctor. That's the whole thing for me. And not because I might still end up being a sports doctor, but I didn't understand that you need to feel the connection and where you're going.
Right.
Because that's more important than the accolades or the facade and the things that surround these universities that you read about. Ranked number 1 in this and ranked number this and that. Don't worry about that. You're going to get everything you need because you're going to seek what you need.
Right. Yeah.
But focus on what gives you the best vibe. What feels good to you? Because if you go somewhere just because of rankings and all that stuff, you may be miserable. So are you going to really get the best out of that situation anyway? Not quite. So I focused on what treated me the best. That interview made me feel like home. I made sure they were my number 1 option. And then honestly, because I felt that, they felt the reciprocal, and we signed on the spot. It said, George, I would hate to see you walk out of here and act like we didn't want you. And if we really want you, I feel like we got to prove it. And they offered me a contract right there, a position right there. And I felt that mutually, and I went with my gut and I signed it. By December, I never actually even went through the match.
That's a pretty interesting story. I don't think I've had anyone on the podcast so far that was offered a pre-match. So some people listening may not even know what a pre-match means. And can you tell them maybe some about what the pre-match is, and maybe even like tips on what makes someone likely to get a pre-match offer?
Yeah, that's interesting. I mean, I didn't expect that going in, right? I told you guys I had about 15 interviews. I was in my 3rd one. I did 1 in Kentucky, 1 in New York. And then at that time, it was the 3rd one. And I was in my Youngstown location where I ended up in my residency in Western Reserve. But I went in there not knowing. I actually was almost, a friend of mine could attest to that today. I actually went into the interview like, man, I want to go to Youngstown, Ohio, man. Nah, bro, I'm not trying to go to Youngstown. I went in there like a little pessimistic. I'm not going to lie. because I had a list of places that I was already interviewed, accepted. So I was a little feeling myself, and I'm like, whatever, but I'm gonna go because they, it's a trip, it's a dinner, it felt good. That was the thing to do. You go on your interview, you get to wear your suit again. I had like one suit and two shoes. That's all I had. So I'm gonna shine today. But I think going to every interview like it's your last. Don't, not appreciate something because you feel like you have other things. You never know. Mm-hmm. Okay, because those positions can fill up. They might pre-match you, and that's the last spot, and guess what? Your opportunity for that was closed, but you could have took advantage of the last one, and you slept on it because you knew he had something else coming. So I kind of didn't do that as well as I should have, but when I got there, my mind opened up, and I was realizing, hey, these people appreciate me. They like my energy, right? They like that I was punctual. That's very important. I showed up on time. I was very honest in my application. I hear a lot of my friends say they speak Spanish and they don't. They say stuff, they just say crazy stuff. Be as honest as possible, okay? At the end of the day, people are gonna know who you are anyway. Right. Let them judge you for who you really are. You've gotten this far because you're great. Trust your greatness.
Yes.
Trust your greatness.
Yeah.
Trust your greatness, man. Trust your greatness. Don't over exaggerate something that you haven't become yet. Enjoy your process. They know you're not the smartest person in the world. Then why are you going into a training program?
Yeah. I think, IMGs, we get scared, right, Doc? Like we feel like we've been told we have to impress, we have to be better than everybody else. Yep. And so we lose our authentic self, and we forget that authenticity actually can take you a lot of places if you're willing to learn and you have the right attitude.
Let me tell you the most valuable piece of information I think any person, IMG, young medical student, fall in love with being wrong.
Right.
Fall in love with being wrong, especially when you're not accountable yet.
Yes.
Listen, debate, question. Don't sit in the back being like, I don't want to look dumb. No, be dumb. You're not going to see these people forever.
Right.
Who cares if that lady in the back that always has the right answer is judging you? Let her judge you. Who cares if the chief resident that knows all the answers and is the gunner knows all the answers and you're scared to look dumb? Look dumb. Guess why? Because years from now, you're not going to be the dumb one. And you're going to be able to speak comfortably and confidently because you asked the right question when not as many people were looking, when you're accountable. Because when you're an attending, there ain't too many people to ask.
Right.
When you're attending, who are you going to ask?
Right.
They're going to be looking at you like, you don't know that? How did you get a job here? What's going on with this guy? Go investigate this lady.
Right. Like, we have to be okay with being learners during the time when we're actually learning.
We're supposed to be learning. We're expected. And I understand the IMG pressure. Trust me. I felt it too. I remember going to the U.S. hospitals and this guy went to this school, or you felt like, even the Caribbean, to be honest, I'm very honest. Even the European students from like international graduates used to feel intimidated, like, oh, that person went to St. George, or that person went to this school, or that person went to this school, or you went to this school. And it's like, we have this internal competition that we can't be wrong when we're all students.
Mm-hmm.
And then you don't actually, capitalize on the opportunity to grow with these people like you should because you're so worried about impressing and showing out versus collaborating and growing.
Right.
Create programs with each other, create, nonprofits with each other, create ideas so that maybe when you guys are possibly going into the same specialty can work with each other later down the line. Network versus, debate and arguing and battle. Network. These are the people that you're going to go out into the world and you'll still need them. You need other physicians. It's not a one-man game out here. So when you're in school, pay attention to the networking capabilities of the people around you. Don't be fearful to speak about things you don't know to people that may know something. It's okay. You all got this far. We're all smart. Some of us just have more interest. We spend more time on certain things. That's why we know more about it. That doesn't mean you're smarter or dumber. That's what they know. So if you don't, you're the dumb one for not asking the question and getting that knowledge. Go get it. So I think that's the biggest thing. Fall in love with being wrong when you're not accountable, so that when it's time to be accountable, you got the answers.
Yeah. Wow. Thanks for that. That was really good. So tell us a little bit about, I'm just thinking sports medicine. Interesting. How do you become a sports medicine doc? What is that process like?
Well, with sports medicine, it's a little different because there's so many angles. Now, there's the way you do it with family medicine, where you have to go and get actual qualification to take an additional test that allows you to be now a specialist on top of your board certification. So first, you have to be American board certified in family medicine, and then you go and take an additional testing that will now get you certified to be a specialist in sports medicine. And obviously, you then go through the process of going into the programs that are going to afford to have sports medicine positions to that nature. Sometimes you may not even go into a sports medicine program with family medicine. You may be a family doctor and then additionally go find another location to do sports medicine. It may not be in the same program. So as long as you have board certification in family medicine or orthopedics, because a lot of options is all through orthopedics. And I believe there's even some tracks with internal medicine where you can now, as long as you're board certified, you can now go into another additional training course and then get a certification in that. And that's usually typically 1 year outside of your board certification and residency in internal medicine, family medicine, and orthopedics. Obviously, me being non-surgical, I'll be considered a non-surgical sports medicine tracked physician, which is sometimes you can do that formally. Sometimes you can do it by even just apprenticeship. So for me, I had worked in different institutions where I'm working at Youngstown State University under Dr. Shina, which is an orthopedic surgeon, and different physicians who given me kind of like an apprenticeship versus me getting an accredited sports medicine degree, sort of say. So you can do it in different ways. Once you've actually graduated, you recognize that there's different routes to becoming a sports medicine specialist. It's more how much your interest and experience is, especially in family medicine. There's so many routes that you can do certain things without quite getting a fellowship in it, but your apprenticeship and your experience allows you to work in that field a little bit more vigorously and do well in it.
Right. Yeah, I think like when I was training, when I started at University of Kentucky, I did the rural tracks. I was at a community hospital for a majority of the time, but we also had a sports medicine track, and they did 3 years of family medicine, and then they did 1 additional year of sports medicine fellowship. But then their curriculum in family medicine was also very heavy on sports, so they had their sports clinic as well.
Exactly.
So yeah.
You end up getting the same training for injections. You end up getting the same training for splinting and knowing all the different sports-related injuries. You're working on the field with the athletes. You're working right by the orthopedic surgeons. You're doing their outpatients because everybody knows surgeons want to cut. They don't want to do follow-ups. They don't want to do non-surgical related sports injuries, follow-up and care. So that's where you get a lot of experience. You work hands-on with orthopedics. They love the family guys. They love the medicine guys that want to do sports because you can help them, you know? They want to do surgery, you do the non-surgical. And remember, the majority of sports-related injuries are non-surgical. So you're going to have a lot of work.
Yeah.
So don't be fearful of that as well, because some people say, well, how do I get into sports medicine without having a sports medicine fellowship? Experience, looking for the opportunities, building networks. So if you had that kid and you were competing with in rotations who wanted to be ortho and you wanted to be family, well, really you should have been collaborating. Like, yo, bro, listen, when you're done, you know, we can do something. You're going down this area. I want to go to that area. I can do your non-surgical cases. You keep your surgical cases. We could do something. Collaboration is key in medicine.
Yeah, that's deep. So some additional questions before we let you go. What tips do you have for, just general advice for IMGs? I mean, as someone who uses my social media to connect and help inspire IMGs, I get a lot of just random questions and different things. And I think one of the most inspirational things that I hear from IMGs is when they see other people that they can relate with, like you, they feel like, the words that you say matter the most because you've been where they've been, you've walked in their shoes. And so you understand, the anxiety, you understand the pressures that they feel more so than anybody else. So we'd like to ask, in closing, can you just give us something to hold on to?
Yeah. Remember that your light shines just as bright as others, no matter how much it seems others' lights shine bright. So to make that bit a little bit easier, don't be fearful of your shine. Continue to shine. Don't be fearful of your process. Continue to prosper. It's okay to feel lost. It's okay to be worried that you're not enough. This is normal because coming as IMGs, we always feel like we are not enough. We come in, a lot of us want to be the gunners. We want to know everything. We want to overshine others. We feel like that's the only way we're going to get noticed because we're from a disadvantage point. It's all normal. That's a normal feeling. But come to a point where you recognize that you are enough. You're gonna work hard, and you don't need to feel like you're in competition, because honestly, you're gonna go exactly where you need to be because that's what you want to do.
Wow, that's deep, guys. You are enough. It's doctor's orders.
You are enough.
Thank you so much for joining us on here. Can you, I
Wow.
know I'll definitely include Dr. Tabi's Instagram link and his website that you guys can visit and connect with him and share
Yes,
all your
please.
remarks. Yeah, yeah. Tell us where to find you on Instagram. What's your handle?
You can find me at AskTabs, at ASKTABS. My website is also asktabswellness.com. You find out more about me, what I'm doing in the Miami area. I've been doing quite a bit. And hit me up. I mean, I'm always open to help. Dr. Nina is amazing. My Cameroonian sister, she's always doing things to help try to, expand her knowledge and expand her wealth of wisdom, to the people that are in the same path as we came through, so it's special to give back in that way. I think people don't even understand right now what you're doing, how impactful it is. But I think like everything, when years to come and things, time starts to go by, people are going to really, really appreciate the gems you're giving out here for people for nothing. These are very valuable things, that invariable encouragement that I didn't have. I didn't have an
Right.
IMG podcast to navigate me. I was just like, man, I'm
Yeah,
just trying to make
yeah,
it. You feel me? Like I didn't have any of this, and that's why I felt it was important for me. I'm like, we need to have that. Like we live in this medical world sometimes can be very cold, and it's kind of like you figure it out. You do your own thing, and it's just like it don't have to be like that. And I think not even just in the medical field, the whole world now, we're all recognizing like we do way better together, right? We just do
yeah.
better together.
Yeah, yeah, absolutely. And I must say this though, Dr. Tabi is just not only a physician and a sports medicine specialist, but he's actually an entrepreneur as well. And I've actually, followed his journey just through Instagram, and I've been very inspired by a lot of the work that you do. This is beyond the what we usually cover on the podcast, but I feel like it's important for people to see what you've been able to create, a medical wellness brand and keeping people healthy, especially during this pandemic, even despite being an IMG. Like, sometimes I feel like we're so in a box in how
Mm-hmm.
we're going to practice medicine. But
Yeah.
here we are, you've created this whole brand around keeping people immune, or helping people boost their immunity, creating products for them. And I find that really inspirational and innovative, because that's what it is. It's innovation to have a mobile COVID testing center like you do, or innovation to have, your own brand of multivitamins and supplements and such. Can you just tell us a little bit about that? Like what you do along those lines as as an entrepreneur and wellness advocate?
Yes, it's been actually really fun. And that comes with why I said, you guys, just please enjoy the process. I pray to you guys. Like, I wasn't meant to be a physician, man. My mom was a nurse from Cameroon, just struggling, trying to figure her out. She didn't even know she was going to be a nurse. She was a journalist in Cameroon. And I've seen her transform to do what she needed to do. And me growing up wanting to be a doctor, it wasn't because I wanted to be a doctor. It's because my mother always told me, her African native, accent, Cameroonian native accent, you get for be doctor because this thing is very important. When all things go fail, this thing go work.
Yeah.
And I used to
Yeah.
say, oh, yeah, I want to be a basketball player though, man. Like, I want to do this and I want to do that. And the way the world is now and with COVID hitting, I always said to myself, yeah, I love being a doctor, but I want to be a doctor my way,
Mm-hmm.
right? I want to inspire my way. I want to be the doctor that I would have seen being young that would have influenced me to say, forget basketball. I want a doctor that made me forget that I should be an NBA player. So I wanted to be the role model that I never had. So that's my slogan. That's my motto I live by. Be the role model you never had. Whatever role model you ever aspired to be that person in the form that you can be. So that's what actually led me to, jumping out the window and creating my own mobile wellness center. That's the ideas that helped me create this, this Jet Setter supplement brand that helped me partner up with Flo Rida, who is a very, very successful multi-platinum international music star from the Miami area. Everybody kind of knows a lot of his big hits, and all these things that come with it. But that came from me being my genuine me, right?
Right.
Once you're a doctor and people understand the professionalism of being a doctor, now you need to learn how to build network, which comes from communication. And so this goes into even treating your patients, right? Not every patient you're going to speak to, you're going to speak with the same jargon. You need to be able to learn to speak to people according to their demographics and their upbringing so you can be relatable. Not everybody can relate to everybody, but you need to at least try to understand where they're coming from, because that's how true relationships are built. Once you have that trust in people, now you can actually develop a network with them and grow, and things can blossom to levels that you couldn't expect. And that's what happened with me, with particularly Flo Rida and a lot of other celebrity people who've helped catapult my wellness concept into the world that has been today and continuing to go. These people are a very vulnerable group of people because when you're in a celebrity light, you're often seen like you got everything all together. And that's where the mental health aspect comes from. They're often the most forgotten people because you think money is everything. People often think that you don't need any assistance. You don't need anybody to talk to. You have all the answers, right? And so they've basically become the people that I've been able to help the most, because in the Miami area, there's a lot of celebrities that come in and out transitionally, and a lot of them don't have insurance. And that's where I came about doing my concierge medicine alongside of me being an urgent care family practitioner. That's where I met a lot of the athletes so I can be able to build on my sports medicine resume. So these things came with me just being genuine and open to different relationships with patients that were clients of mine that had other things that they did in society that them and I could build together with and create. And it's just being open with, ideas and not being restricted and feeling like, I'm this IMG, I graduated, I got to walk this fine line. You can be creative in medicine. You can be creative in medicine. You've graduated, you've earned the right to be a scientist, right? You're a scientist, you have the ability to look at situations, assess them, figure out what the need is, what is the niche, and fulfill it. And the niche in this case is the celebrity medicine realm is kind of voided because people assume, people that are celebrities have all the answers. And that's why you hear a lot now in the world about mental health. It's a lot of, celebrity syndicate shows like Charlamagne the God and the Breakfast Club. He's often advocating mental health. Yeah. You got other doctors like our colleague, Dr. Jess Clemens in New York, who's a psychiatrist who does a lot of mental health wellness stuff. I have a couple of doctors out here, Dr. Sophia Lynn, who's an ER doctor who is very big into CBD and wellness. So these are doctors from different realms jumping into different realms of the world, entertainment, cannabis, and all of this is through the intention of wellness. Our goal is to do no harm and to give the best option for each patient. And I think especially as IMGs, we are the example of that. We went out of our way. We did not take the typical track, right? Correct. We took the road that's less traveled to become what we are. So it only makes sense we should continue to push the envelope, push the unforeseen narrative to do things that people and other physicians would not. We are the most likely to create, to be the most innovative because we took the most innovative route. If we weren't accepted to Duke or to Harvard or to Howard, guess what? We're going to the University of Watcha to get it done.
Yep.
Get it done. And don't be afraid to shine. Don't be afraid to do something outside the norm of what every other physician is doing. Our society is very comfortable in a physician society to say, well, what that person doing? I don't know if is that right? You make it right. You create it. If they don't see it and they don't know it, that's why it looks new. That's why they're going to be criticized. Anybody else doing anything that's different will often be criticized. What great thing that you do is not criticized. And I think often as IMGs, we're so afraid of criticism because we already feel like we have already a critical piece targeted on our back by not being traditional American grads, that we're afraid to do anything outside the box just off that because we really feel like we're already outside the box. Think the opposite. Think, you know what? I'm already out here. I might as well do what I love. I might as well do what I want.
Yeah. I agree with that 100% because, I mean, that's even with starting this podcast. It was correct. Nobody's doing this. Oh, well, I'm going to do it. Right?
Yep.
Yeah, I definitely agree with that. And I think a lot of times we get stuck in like being put in a box that we can't get ourselves out. But you can do just about anything you want to do. Anything. Anything. It's possible.
Anything, man. anything. And I think COVID-19 showed us that we need more doctors to be innovative, because what are we supposed to do? A lot of us has lost our jobs as physicians due to the business aspect of medicine. A lot of us, I was talking to my mom and I was like, Mom, isn't it crazy? Like, we always, not because we're still not the most important position and field in the world. We're dealing with people's health and livelihood, right? But for the first time, I think a lot of physicians were shaken up because they had to close their practices because they were having to quarantine patients. So how are you going to pay rent? You have no volume. A lot of hospitals were closed. A lot of things that were considered guaranteed for physicians for so many years were just shut down. So I think a lot of people became even more fearful. And I think a lot of younger physicians were kind of like, where do we go from here? But I want everybody to know that despite all the odds, you're still better off than a lot of other situations, because at the end of the day, you're still the most needed. Don't get the business misconstrued with the truth, right? The truth is you're very needed. Yes, there are physicians being laid off. Yes, there's physicians' offices being closed and businesses being relocated and different unfortunate situations come from them. But that doesn't mean that your worth as a physician has decreased. No, it's just the business of the world has changed. And that's why you have to be more innovative and more creative and more open to being an entrepreneur, a doctorpreneur.
Right, a doctorpreneur. I like that. On that note, Dr. Tabi, we thank you so much for being on the podcast.
Thank you guys so much.